Nerve stimulator guided lumbar and sacral plexus block. As we all know, the plexus are sandwiched within the posterior third of the psoas muscle. You can see the posterior third of the psoas within the substance of the psoas muscle. Here also you can see it is on the posterior third of the psoas muscle, anteroposterior. This is a capitalist approach for lumbar plexus block. First you have to draw a line from the L4 spinous process laterally such that it cuts the imaginary line from the posterior superior iliac spine. The line is divided into medial two-third and lateral two-third. That point of that is the needle entry point. So the needle is inserted first. If you encounter a bone, mark the with your middle finger, mark the distance from the skin to the needle. Then you, so that it avoids too much avoids further proceeding of the needle and provides traumatic damage. My middle finger will be a guide so that I don't pass too much beyond and to avoid vascular punctures. As I go in, slowly go in, when it is passed beyond, means that I am passing beyond my middle finger 1.2 centimeter will go, I will get the patellar dance. You can see the quadriceps contraction. This is lumbar plexus. Now sacral plexus, it is formed in front of the piriformis and they exit the pelvis through the greater sciatic notch. Let's see how it is done. So this is Mansour's approach, 6 cm below the posterior superior iliac spine. That will be your entry point. So I introduced my needle with connected to a nerve stimulator of 1.5 milliamperes. Same goes for lumbar plexus too. As I advance my needle, first I'll elicit superior inferior gluteal nerve stimulus, that is your gluteus maximus contraction. So it confirms that you are now you can see the contraction of the gluteus maximus. That means you are on the path of the sacral plexus. So that means in 1 to 2 centimeter you will get the plantar response. That is a good sign. So as I drive my needle further, I'll get the plantar response. Let's see how it's gone. Some patients, elderly patients, some patients will be cooperative. You need to sedate them. Some patients won't be cooperative. In that case, we have to sedate them. Some patients are cooperative. You better let them be conscious. You can't sail on two boats. So now you have the plantar response. So you start with 1.5 milliamperes and gradually reduce to 1 and 0.8 and 0.6. 0.6 is advisable in elderly for plexus blocks for a successful blockade. Thank you.